Hello, my name is Catherine Stokes and today I'm going to be talking to you about doctors running late.
What are the main reasons that a doctor is running late?
Usually you'll find there's a manner of things. Could be an unforeseen emergency. If a patient has arrived who is particularly unwell, it may take longer than the allotted time that the patient we've been allocated. 15 minutes is our usual standard time, but quite often this can go over. Otherwise, sometimes it can be a doctor that is running late. Traffic can have an impact. Something's happened to them in their morning. Another, as I said earlier on, is multiple patients who have taken just that little bit longer over the time that they've been allocated of 15 minutes. It can be something that, and also one of the last things is also technology, software or equipment failure. It's always happening. We have had a new recent version of our best practice software, and it's a little bit perilous at the moment to say the time that it's taking for it's crashing. It can be something as simple that printer not working. It can be something as simple as that.
Can you go over the basic procedure that the receptionist will need to do when arriving a patient of a doctor who is running late?
When a patient first arrives at the desk, they obviously will need to do the usual identification checks. The receptionist will ask them who they are, who they're going to see. This will get identified in the usual way. Also, first thing you probably do is let them know that the doctor is running late, excuse me, if they are. And also it's a really good idea to approximate how long they'll have to wait. The next step would probably be, if the patient is, ask them if they're happy to wait for the doctor. Would they like to go away? The location where we are on the jetty means that we have got coffee shops and little shops available next door and around where we are. But quite a lot of the time, patients are happy to go off and run an errand or have a cup of coffee and then ask them to come back, which means they've just got less wait time in the surgery. Also, another thing to remind yourself of is to maybe ask if they are on a time frame, because if they are, we can let the doctor know this, and maybe they can sort of pull them in a little bit earlier than what their pre-arranged time was. If they can't unfortunately wait for the delay, it's really important to make sure you rearrange another appointment as soon as possible for the patient at a convenient time for them.
What can you do to try and reduce wait times or minimise the impact that it has on patients?
Basically, the key point to this, I think, is to communicate to the doctors. So from our recent survey, we had that it was patients are having to wait for 15 minutes or over. A good way to do this is to talk to the doctors at a doctor's meeting, or we have regular training sessions at Northside Health, so we can utilise that training session in order to be able to talk to the doctors as a whole, and this is then in a non-specific way. And as I said earlier on, one of the vital points is to pre-program your reception staff to make sure that they know to tell the patient if their doctor is running late. This is key. This is a vital point, because then the patient then has the decision to either stay or to go. Another really good tool would be to create interruption lists, which we have at Northside, and they can be included in the information pack for all receptionists. So this is then a feedback that you obtain from your doctors, and then that's a list of basically what things they are prepared to be interrupted by the reception staff in order to take a phone call. And these little things are things that add up to making a doctor run late. So make sure those interruption places are in place, they're regularly reviewed. These can be done again at training sessions that the doctors come to regularly. And like I say, the best thing is to keep the lines of communication open. Give some encouragement when we can improve our waiting times, and we get feedback from our patients to say, again, resurvey the patients, make sure that this feedback is coming to the doctors. That's probably the key things today. I have included a flowchart of just basically the basic steps when a patient does come to see the doctor and there is a delay running. This is included in this PowerPoint presentation and also my main submission. Thank you very much for listening.
That sounded